Again, here's the financial terms. Co-payment, deductible, co-insurance all mean three very different things. If you are faced with a service, you have a service coming up, whatever it is, a trial, a diagnostic imaging test, chemotherapy, all one or all three of these things may apply to you. So understand what each of them means, and then ask the question of your health plan. If you're not sure, if I receive chemotherapy at XYZ facility, am I subject to a copay or deductible or co-insurance? These are all types of questions that your health insurance plan can help you out with. Out-of-pocket maximum, lifetime maximum, this is critical, especially for those of you facing or have faced cancer. These are maximums that insurance plans place on you and on what they will pay out and on what you should pay out. Understand what these maximums are and figure out, just kind of keep a log of where you are in meeting them, because lifetime maximum is the maximum amount that an insurance plan will pay during the life of the policy. Once they meet that maximum, that's it, and the rest becomes on you. Many times, $1 million is a common lifetime maximum. And of course, with cancer treatment, you can blow through that in no time. So once you hit that $1 million mark, the rest is on you. It's something I believe that the new legislation is trying to eliminate that from health plans. So we haven't seen that yet, but we may very well see no more lifetime maximums in the future. Usual, customary, and reasonable. This is something that comes into play if you leave your service area. If you're, let's say, you're based in Houston and you want to go to New York for health insurance cover or for some type of treatment, your health plan may pay at what's called usual and customary. This is there's no negotiated rate here. There's no rhyme or reason to what a health plan comes up with what they determine to be usual and customary. It's a shot in the dark. So if you hear those words that's how your health plan will pay, that be very aware of that, because you'll be responsible for what the health plan doesn't pay. And very often you may be faced with high bills in usual and customary situations. And there is no negotiation, there is no approved rate on that. That is just something that the health plan kind of uses as leverage to keep you in their network. So watch out for usual and customary. Fully insured, self-insured, that gets kind of more on the business side of that particular health policy that you purchased. But again, very important to know, because depending on what type of policy you purchased, this will tell you who you need to go appeal to. For instance, if you want to appeal a non-covered or denied service, if your plan is fully insured, you can write to the State Department of Insurance. If your plan is self-insured, which large employer groups tend to be the self-insured, where they can kind of custom design their own plans, then you can write to your particular employer and say, you know what, this is a non-covered benefit under our plan. I'd like to appeal for coverage. Here's why. Here's my doctor's letter. Please help me. So understanding whether your plan falls into one of those buckets will help you decide who to appeal to or who to get that approval from. Pre-existing, we don't really have to talk about that, but I do want to call your attention to credible coverage, the second bullet up here. This, in keeping with what we talked about, trying to avoid gaps in coverage for when you've been covered for cancer, if you are going to be changing jobs, or if you're going to have get COBRA, or anything causes you to leave what you're currently under to a new plan, you absolutely want to ask for a letter of credible coverage from the health plan that is currently covering you. And what that letter does is it will help you get coverage under your new policy. So this is so important, and I don't know if that many people understand about what this is or why it helps them, but it is supposed to help them. It is supposed to help you get coverage for your pre-existing condition under your new health policy. So you absolutely, if you know you're going to leave your company, ask for a letter of credible coverage from your current insurance plan. Send that to your new insurance plan, so that again will continue the coverage for your pre-existing condition. Very, very important. I talk a little bit about what an HMO, EPO, PPO, point of service plan is. These are just kind of the four basic plan types that are out there, but health plans have all kinds of different spins, just starting kind of from this base plan list here. But again, familiarize yourself with what type of plan you have. Is it an HMO, which is usually the most restrictive, or is it a PPO that allows you a self-referral option? Figure out what you have, and then what options you have available. In-network, out-of-network, again, that's where that comes into play. Health plan resources, I listed a couple of good places to start here if you have questions on your health plan. Your benefits manual, that thick thing that we all get when we sign up for an insurance plan, always a good resource. Again, not expecting you to read every single page, but get to know it when you are faced with a life-changing event like cancer. Customer service department at your health plan, a patient-friendly website. Many major health plan carriers have websites for patients, just like they do for physicians on our side when we verify benefits and eligibility and so forth. You also have that available for many of the health insurance companies out there. And the Texas Department of Insurance or any state department website is also a good resource to see what's going on with health coverage. And then I just kind of run through some questions to ask your insurance company. And again, this is coming back to being accountable and understanding what you should know about your health plan. Just getting the basics, the full plan name, that probably speaks for itself, but make sure you know what the plan type is, HMO, PPO, point of service, in and out of network benefits. Will my benefits be in or out of network if I visit whoever you want to visit? And then you want the financials, copay, deductible, coinsurance. What does that mean to me? Lifetime and service maximums, what are they and how much have I met towards them? Chemo, radiation, lab tests, find out if they're covered for your diagnosis, and if not, if there's anything I can impart to you, it's this. There's always an avenue to, like Yulia said, the buck doesn't kind of stop at the front door. You don't just have to say, oh, okay, it's not covered, it'll be on me. There is always an appeal channel within your insurance company. So use it. Ask that frontline customer service, who do I need to write to get my case looked at? I'm eligible for a trial. I'm eligible for a stem cell transplant, and this is not covered. Who do I need to write to get it looked at for coverage? And not only that, make sure you can get it for in-network level of benefits, because again, that means less money out of your pocket if you can get it looked at for in-network. So I've just kind of outlined, I don't want to spend time reading these slides to you, but questions to ask, how to ask them, and who to ask for. Pharmaceuticals, and I know you guys that have faced this disease know that you will have tremendous costs when it comes to life-sustaining and life-maintaining pharmaceutical coverage. So it's important for you to understand that coverage as well. Supply limits. Many of these drug plans have supply limits. Yearly, I'm not sure. You have to ask your drug plan if you have one. But anyway, these are some other specific questions to look at. Clinical trials, if you're eligible for a trial, these are kind of a new line of questions to ask your health plan. Again, how do I get it looked at for coverage, and who do I need to write to? Get your providers involved. Physicians, nurses, any of you, the clinical staff that is working with you is more than happy to help write a letter of appeal with you. We will do that on our end as a provider. That's what we do. But you can help yourself by doing the same thing. If both of you do it, if both of us do it, and you work together with your providers, you can get the most use out of your insurance plan. We touched on stem cell transplant. Again, something that is routinely just not outright covered in many cases. So if it is not a covered benefit for you, just a whole slew of questions to ask for stem cell transplants. A lot of them revolving around financials after it is approved. But if it's not a covered benefit, how do I get it covered, and who do I need to write to? And I know this is overwhelming, and in the face of your disease, this is probably the last thing you want to deal with. So that's why it's important to have supportive spouses, friends, family. Get them to help you out and be your champion, because again, you've heard from panel experts, you've got to be the champion of your own health care. And so once you find the right health plan, get involved, understand the basics at the outset, but then when it starts getting into the nitty-gritty, then ask those nitty-gritty questions. Don't be afraid to ask your health plan. That's what they're there for. They want to keep you happy, especially in this day and age. They're a business. They're running a business, and so you guys are their business. So they want to keep you happy. Where there is a will, there is a way. There's an appeal avenue for everything. And then working together with your providers, so everybody's on the same page on how your benefits work, then that is just a win-win for everything. So I hope that was somewhat helpful. A lot of information here, but you can get that off the website later. So thank you very much.